Yeah, we got Dr. MJ Collier on the phone. Dr. Collier, good morning.
Good morning, Rickey. Good morning, Brett.
Hey.
Good morning, Eva. Rock T, Special K, and Gary with the T. How you doing this morning, Rickey?
Man, we doing good, Dr. Collier. First of all, thank you for waking up extra early because we know you have a long day. Because I know when I talked to you yesterday, you was getting in the house by 7 o'clock. You working 12 to 15 hours every day with everything that's going on. And you taking the time to wake up and join us this morning, to join us every morning to give us information on how to stay safe, and talk about the coronavirus. What's the latest?
Well, as you know, California now has a statewide shelter in place order going. And this, again, people are asking, why are they making us do this? I was out yesterday just listening to people have a conversation, Dolores and I, and we were just amazed at particularly some of the young people and their lack of understanding of what's going on. One of the people was planning a social outing in real time. They were wanting to meet people at the mall. So the biggest factor in whether the virus becomes recurrent, whether we can control it, one, and then whether it becomes seasonal like the flu or recurrent, is whether we can control the level of transmission. This is now a pandemic, which means it's prevalent everywhere around the world. It's also now endemic, which means it's circulating constantly in the local human population. So we can stop that from happening by social isolation and trying to keep people from literally just passing it from one person to another. Now, yesterday, we broke the news early, before CNN, before the president made the announcement, that there are several things that they are utilizing and trying to test to see if it's very effective for active treatment of the COVID virus, the coronavirus. Now, we talked about yesterday, there is no viral-specific treatment, but they have a drug called chloroquine. It's 70 years old, Rickey, and it is an anti-parasite drug. It's been used to treat malaria.
Right.
I write it all the time for patients that are traveling to Africa and other countries, and the dose is one pill one time per week. And you take one a week while you're in Africa to treat malaria. And it's thought that by some mechanism, because it is actually an anti-parasite drug, and it stops the malaria parasite from entering the red blood cells and replicating. Now, it's thought that by some mechanism of action, they're not quite sure why, it stops viral replication, and that's why they're considering using this. It's been reported to be very successful by some Chinese scientists in China, and so they're doing some quick studies here in the United States. But, you know, that medication is even available over the counter in the United Kingdom and Mexico, other places. You can literally just walk up into the store and buy it, just like you buy Tylenol. So it's still prescription in the United States, and, you know, again, it's showing a lot of promise, and hopefully that will be one of the things we can utilize for that. Because right now they're using it for treating things like rheumatoid diseases and lupus, juvenile rheumatoid arthritis, and a thing called Sjogren's syndrome, which is an autoimmune disease.
Right.
Now, they are also looking at anti-flu medications. You know, we have a couple of medications, particularly Tamiflu, that's used to shorten the course of a flu infection and hopefully to treat it actively. But and then HIV drugs, and you see HIV drugs being advertised on the television, you know, particularly in the evening, very often. But they have one called Collier or Lubia, and all of these have shown that they're blocking viral replication and working very effectively with the coronavirus. So those may be treatment options that are available as well.